Hi, my name is Shawn Healey. I'm the owner of Carpe Diem Pilates and Coraline Training Centers, as well as Carpe Diem Studio Consulting. From the beginning of my career, I looked at how we take a person from dysfunction in a rehabilitation setting and transition them all the way to a higher level of functioning for them, their optimal place. What I'm really wanting to look at today is how do we do this? How do we think about this area of transition? If we understand this better, from a therapy perspective, we can provide a situation where patients are transferred and moved beyond what their scope is into this transitional training area. This is the area that I feel like we fill from a Pilates and Coraline training perspective. How do we take that patient and take responsibility, transition them into their optimal level? Part of this is having the skill set to be able to do that. I think in our industry there's a lot of people that are really fantastic at what they do when it comes to this transition, but it's also an area that we need some work in. What we've done over the last 15 years is design systems to help understand that transition process. We've developed a course called Functional Intervention. We actually have 3 parts to this course, and I want to introduce you to the first part today. The idea of functional intervention is taking somebody from that therapeutic perspective and transition them into what is their optimal level. So what is an intervention? The act or fact of intervening. When looking at what it means to intervene, there are a number of different ideas. Really what I want to look at is number 4 and 5 on this list. To modify or hinder, and to interfere with force or a threat of force. When applying the functional intervention concept, this is exactly what we're doing with a patient or a client. But it's important to understand that this falls along a larger therapy continuum, where on one end we have rehabilitation, therapeutic intervention. This is rehabilitation for physical therapy, chiropractic. And on the other end, we actually have optimal function. This is where we're trying to get our clients and our patients to. Now the functional intervention area of this continuum falls right in the middle. At one end of this functional intervention continuum, we have rehabilitation transferring into a more functional environment. At the other end of a functional intervention process, we see advancement into higher level activities. To be safe and effective in a functional intervention environment, we have to understand where people have come from in their past with their injuries, as well as where they're going. What is their optimum? I'd like to introduce you now to Kent Kaiser. He's been a friend and colleague for over 15 years. He's taken our classes and seen firsthand, both in a reformer setting and a Coraline setting, how this concept of functional intervention can be effective. I hope that you enjoy what he has to say, and I hope to see you all in one of our functional intervention courses soon.
Hi, I'm Kent Kaiser. I'm a physical therapist and athletic trainer, and also a manual therapist in the community of Eugene for 30 years, and been asked to make some comments about a very interesting course that's coming up. It's called Functional Interventions 1. I've been able to work closely with Carpe Diem, the business that's presenting this course for everybody that's going to follow up on interest in movement, re-education, and in particular for me, a concept that my friend Shawn Healey and I talked about for now 10 years, which is about what do you do with the changing times in healthcare. Rehabilitation for physical therapists that once was the domain where we worked on training people out of rehab into fully conditioning a person to their maximum and optimal self. So I remember back when I first started in the 70s and 80s, sports medicine was full go. It was an exciting time. We really, as physical therapists, got to do exercise training and modifying for people that had injuries all the way through to their final recreation, sport activity, etc. And it was an exciting time. But times have changed. Those of you who have been out for as long as I know that in the 90s we had health maintenance organizations come in and really micromanage. Well, I think we're kind of in that time again, and it's difficult. We know that we have very specific things to do in rehabilitation, and for people that aren't in rehabilitation, they're trying to fit into a teamwork pattern that's very hard to do because everybody's so busy doing a lot of paperwork, and most of you know what I'm talking about within the new Affordable Health Care Plan. So what Shawn and I looked at was, how do we get something that really moves seamlessly in a teamwork from rehab to conditioning and training? But for those people that can't really go full force into training, they needed something that was transitional. Again, I use that. And I like the term that they've come up with now, which is this functional intervention, because really what we're trying to do, and they're trying to do, is provide ideas that are really powerful within the systems that they've developed. I've made comment and I've given testimonial to that before because I believe in what they do because I've been in it. I've been able to do Pilates now for 11 years on their reformer training program. My friend Healey, who has provided many kinds of core programs of development from very low-level training all the way up to advanced level. I've seen that in its works over the last 11 years. And now the work with the core line, which I think is a fantastic piece of equipment that I think should be in every physical therapy office to really work on automatic core types of training and programs. And I think this is where we are for the future, but I wish that it was something that we had more in physical therapy. So if you're interested in this class that they're developing, then you're going to be able to think about how can I do this in my own center and be a better trainer as myself, or as a person from transitional to conditioning, or how can you use more forward-thinking, cutting-edge groups like Carpe Diem, which are really out of place in their training programs that I just think are so much farther ahead than the old traditional go to a gym, find somebody that works there that knows how to do weight training, looks good, but really doesn't know how to work in a smart way for optimal health. So in short, I'm really saying that this is a course that I think is going to be really exciting to go to, provide very solid elements of interventional type of thinking that we said that was going to be transitional, is going to give you a whole new idea from some systems to look at how to work with habit changing for people that we know is very difficult in the sessions that we have in physical therapy now. All in all, I think a very good course to consider, and you can tell by my enthusiasm and my wanting to do this testimonial that it's something you should definitely look into.
Whether you're a rehabilitation professional in a clinical setting or a Pilates or core line instructor in a studio setting, the functional intervention coursework is going to help you take these people to their optimum level. Thanks for watching. For more information on our functional intervention courses coming up in the future, please go to our website at www.carpediemstudioconsulting.com. If you have any questions, send me an email at Shawn@carpediempilates.com or give me a call at 541-684-0577 at our studio.